welcome to Boomer Health at Home. I'm your host, Maggie Jess, and today I am joined by not only one, but two nurses that serve us here in Oakland County, Kimberly Snowden and Kelly McQuinney. Hello, ladies. How are you today?
Hi, doing
Great,
well,
thank you.
thank you.
Thank you so much for coming on our show today. We're just going to kind of talk about everything that you guys kind of have available within the county so our viewers can kind of get a feel of what to expect for 2020 and 2023. So if you each could kind of just give me a background of your nursing career and career with Oakland County.
Sure. My name is Kimberly Snowden, and I'm the Chief of Medical Services here at the Oakland County Health Division. I've been with Oakland County for about over a year now. And before my time here at Oakland County, I was with a major hospital system in the area for 15 years. My background consists of maternal child health. I'm a family nurse practitioner with a board certification in lactation. So I've seen ages cradle all the way up until the elderly years. And I really, really enjoy my time with patients throughout Oakland County and serving as chief.
My name's Kelly McQuinney. My background is actually very similar to Kim. I've been with the county since 2018. I've worked in the clinic as well as in special programs and nurse on call as a public health nurse. I have my master's in nursing. I'm also a family nurse practitioner. And before coming to Oakland County, I've spent a few years working in OB and maternal health as well.
Wow, so you both are very highly qualified to be. That's wonderful. Thank you so much for your services and what you do for us.
Of course.
Thank you. We really enjoy it.
Good. It sounds like it. I mean, I'm a nurse as well, and I feel like nursing is a calling, definitely.
Mhm.
It really is. And all nurses, I feel like, especially here at the Oakland County Health Division, we really have a passion for our citizens. So that's what makes us really unique is we're happy to come into work every single day and it's serve every citizen of the county.
Oh, that's wonderful to hear. That's very nice. So with the recent pandemic and, all of this talk about vaccinations, what's the status of vaccinations in our county with both COVID and just regular vaccines for children, pneumonia for adults, shingles for adults? How's Oakland County doing?
So Maggie, I am so glad that you asked this question because just the other day, the FDA and CDC approved boosters for children between the ages of 5 to 11 years old, 5 months after completion of their primary series. So that means if they got doses 1 and doses 2, 5 months later, they can get their booster. So right now, Oakland County's doors are open, ready to serve. You don't even need an appointment. You can come in any time of our office hours, Monday through Friday. You could make an appointment if you wanted, or just walk in. Our doors are open all the time. The county's doing pretty well on general vaccines, but because of the pandemic, many people across the United States and Michigan and all counties have decided to forego regular healthcare visits. So we really, really encourage people right now to go in and see your primary care provider or whoever you see for your care. They'll let you know what immunizations you need to be updated on, or just walk right into our north location or our South County location clinics, and we'll be able to tell you what immunizations you need and give them to you right on the spot.
Oh, that's so wonderful. Okay, so making it very easy for people to get all of their vaccines.
Absolutely. Come on in. We're open and ready to serve.
Oh, that's great. So I know you mentioned that all your clinics are open Monday through Friday and the times, but is there like a website people can go to, some phone numbers to call if they're inquiring about certain vaccinations and where they can get a certain one?
Yes, that's a great question. So actually the division that I'm working right now is nurse on call. So we have nurses staffed on all of our phone lines Monday through Friday from 8:30 to 5 p.m. You can call that number. They can get you the appointment, give you further information on it. If you prefer just to access our website yourself, you can go to oakgov.com/health and actually sign yourself up for an appointment if you'd like. But our nurse on call department is a great resource. not only just for vaccine questions, but really about any general medical question any citizen in Oakland County has.
Okay, great. So as a lot of our viewers know, I'm the Director of Nursing at AmeriStaff Nursing Services, and we take care of a lot of seniors. We rehab them for a lot of PT and OT. And what I'm noticing, since I've been at this job for about 4 years now, is our previous generations of like my grandmother's age, they weren't really that active. My grandma didn't do a lot, but what I'm noticing now is seniors are very active. They really want to get back and moving to their regular daily livings. They walk every day. They want to be out and about. They like to travel. They're really doing a lot. So does the county have programs for active seniors?
So I'm glad that you asked this question too, Maggie. The unique thing about Oakland County is we have senior centers spread across the county. At these senior centers, where they're a place where active seniors can engage in the community through recreational activities, hobbies, dining, and classes. My best advice is to log on to your local city, town, or village's website to find the number for the local senior center. Many times their activities are located right on the website, and many times they also offer transportation. For example, if you're in the mood to go on a big shopping trip, your local senior center more than likely has a bus that'll be able to come pick you up and take you with another group of seniors on a specific day or time so that you can really enjoy your day.
Oh, that's fun. And hopefully meet some people and socialize a little bit more.
Yes.
I think socializing is a lot of what seniors miss out on.
It really is. And the senior centers are really a bridge to the community and allow seniors, many seniors centers will have like book clubs where you can donate books, sit around, enjoy a nice meal, and then get out and go to different places like stores, casinos, wherever, while masked, of course.
Oh, absolutely, absolutely. Okay, great. Thank you. I'm going to kind of now go to what both yours and Kelly's genres are in the realm of babies. So I've been noticing a lot of my friends are having children. Everyone needs a really good babysitter and or nanny, and a lot of them are turning to their parents. They're retired now. They can watch their children. They have the time to do it. So do you guys have any tips for up and coming grandparents that are looking to babysit now? The summer's coming. What are we doing? What are some new trends that maybe our parents think they know, but we've kind of changed the regulation on them without them knowing in that time frame?
Sure. So I think one new trend that I've seen, even just by answering phone calls through county citizens, is a lot of grandparents are actually obtaining their own CPR license or certification just to have that extra knowledge base should something happen. Some of these grandparents are going through either the Red Cross or the American Heart Association. I would say a tip I can think of is any grandparent, parent, or even family or friend who has close contact with a newborn or an infant. It's always a good idea to make sure that you're up to date on your Tdap vaccine, because that contains the pertussis component, which is the whooping cough, which can be very severe and detrimental to young newborns and infants. So if you've not had that in the last 10 years, you can come into the county and become up to date on that vaccine. So those are two things that come to mind with that question: your CPR certification, and then making sure you're up to date on your Tdap.
Okay. And now with the Tdap, you said 10 years. So is that something that you get every 10 years?
To become up to date, it's recommended that you get at least one dose once every 10 years. Yes.
Okay. Good to know. That's great knowledge. All right. Thank you. So another thing kind of relating to baby, but more supply chain, because we keep hearing about baby formula and how it is unavailable. And then you keep seeing any type of social changes with things. Oh, I found it here, come here, get it from here. So with these supply chain problems that we're having and or shortages, have you seen any effect on the county? Has it affected your daily work at all?
So I'm glad that you asked this question too, Maggie. I actually just did a radio talk yesterday and an interview with Fox 2 News about the formula shortage just a couple days ago. My best recommendation to parents out there is to go ahead and call your local doctor's office or the physician that your child already sees and see if they have any samples in the office. Don't try to water formula down or make your own formula at home. And of course, I always recommend breastfeeding as the best choice for infants all around. So even if you stopped breastfeeding not too long ago, you can do something called relactation. In Oakland County Health Division, if you call our nurse on call line, we can get you in touch with international board certified lactation consultants that can help you rebuild that milk supply or answer breastfeeding questions. But to get on in about supply chain issues in general, one thing that has not been affected is vaccines. So we have plenty of vaccine. So I don't want people to be sitting at home thinking, oh, I don't know if I should go in because they might not have it. We have plenty of all the vaccines available, and we actually have not seen any kind of supply chain issues on the vaccine end of things. So we have plenty to give, and our doors are open.
Oh, great. That's very good to know. Yeah, because you want to know what sector is really affected. And it kind of seems like maybe only baby formula at this time is affected.
Yes, unfortunately, the baby formula shortage has been something, but there is something that has been good. The WIC program is right now allowing people to go ahead and use different formula substitutions. So for example, let's say your baby usually takes Similac formula. Right now, there is a clause that allows for a substitution. So if there's another formula available, you would be able to use that.
Oh, perfect. Okay. That's really good to know. I hope there's a lot of grandparents and moms watching this right now. That's giving them some relief. So my next question, I was kind of going through your website after we knew that we were going to interview you two ladies, and I was looking at that you have a safe medication program. And I know with a lot of seniors, they have a lot of questions. A lot of our patients at Amera staff really feel like sometimes their medications are kind of talk to them when they're in the hospital, but you don't feel good when you're in the hospital. And then when you get home, you have more questions like, how is this going to affect me? Do I really need to take it in the morning? Can I take it at night? You know, what if I don't want to take any more of my pain medication? How do I get rid of it? What's the safest way to do that? What can you tell me about this program basically that you have?
Sure. So the program has a lot of different opportunities it provides to county citizens. I would say if someone has a general medical question about their medication or their condition, they're welcome to call Nurse on Call. We'll answer it the best we can. However, sometimes their primary care physician is the best person to go back to if they are the one that prescribed it. However, we're more than happy to help and assist the best way we can. Our website, oakgov.com/health, also has a map on it where seniors and citizens can zoom into wherever they live and find a safe disposal site for their medication, somewhere that they can go to drop it off safely where they know it's going to be in good hands. Our harm reduction program, if someone has further questions on that, they can always email ochd-harmreduction@oakgov.com, or they can call 248-858-1729. So there's a number of options.
Okay, perfect. Great. Thank you. Also, while I was looking through your website, I looked at the SAVE Task Force. What does that stand for? And basically, what is it?
So the SAVE Task Force stands for SAVE, Serving Adults Who Are Vulnerable and or Elderly. It was launched in 2005 to increase awareness about elder abuse. Town hall meetings and trainings have been hosted through SAVE for citizens and professionals who want to learn more about identifying and reporting elder abuse, which is so important. If you suspect that elder abuse is happening, like someone's being abused or neglected, make an anonymous report to Adult Protective Services. That number is 1-855-444-3911. If you are not sure, call and talk with the professional who can guide you.
Okay, perfect. Thank you. I definitely wanted to touch on that. I think it's something that we don't talk enough about. Being in home care, you see all kinds of different ways of living and treatment of other people and patients. And I just wanted everyone to be aware that there is somewhere to go and there is people to
Absolutely.
contact.
Absolutely, there is. Again, that number is 855-444-3911.
Thank you. So Kelly, in your opinion, we've talked about how we do have a lot of vaccines and we are on the right track within our county. Is it the advice of Oakland County Health Department right now for seniors especially, still be wearing masks out in public?
Sure. So it's never going to hurt for anyone, no matter your age, your background, your medical conditions, to wear a mask. Masking helps keep people safe and it helps to decrease the spread of COVID. So I would encourage people, again, no matter your age or background, to wear a mask. It's going to help decrease the spread of COVID and keep them safe.
Okay, great. Wanted everybody to hear that. So thank you very much.
You're welcome.
And Kim, I know we touched on the senior centers earlier in this show. Can you give me an idea of what kind of to expect if I were to, let's say, drop my mother off and say, go have a great time, see ya? What would she expect to see? Will there be someone there to greet her? How does that kind of work?
Absolutely. So the nice thing with the senior centers, and I've experienced it myself when I've taken family members, is you're greeted by usually another member of the senior center with a warm welcoming. And many times there is food and treats there, and you can sign up for different programs, things like Meals on Wheels and things like that you might even not even know that you need. You'll have a plethora of information and support when you walk in those doors. A senior center really is the focal point in a community where older people can come as groups or individuals to support their independence and enhance involvement within the community. So it really, when I say a focal point, it is a focal point. And if you're a senior out there thinking, well, I don't know if I'm going to go, I would really encourage you to go into your local senior center and check it out. You'll have a lot to contribute as well. Different senior centers offer different programs. Most of the senior centers in Oakland County provide programs and activities associated with healthy aging, recreational activities, community dining, or human service programs.
Oh, wow. Okay, great. Yeah, that sounds like it encompasses everything. And really you could find your niche there, one thing that you like to do.
Absolutely. I happen to know a senior that donates books to the senior center and has created a book club at one of the local senior centers. And it's really changed his life in the last few years.
Oh, that's wonderful. Kind of gives you a purpose and something that you enjoy to do.
Absolutely.
Oh, that's so great. So Kelly, I have one final question and then you guys can get back to your day, I promise. So area on aging, we get a lot of phone calls from people inquiring, area agency on aging gave us your number. Are you able to take care of my mother, or are you able to, recommend us a physical therapist? What do you know about this agency and how does it kind of work? What do they provide?
Sure. So the Area on Agency, it's a nonprofit organization. It assists people in obtaining access to programs and services that will hopefully allow them to remain living independently in their homes, maybe by themselves or maybe with a caregiver, but within their own homes. They do a lot of great work. They provide in-home care, Meals on Wheels, transportation, community dining, as well as they can take the seniors to these senior centers that Kim just spoke on, where they can find new hobbies, take a class, exercise, and socialize. So it's really a great agency. It's located in Southfield, Michigan, right off of Northwestern Highway. And their phone number is 800-852-7795. So if anyone has any questions, they can always give that number a call and learn more about it. But it's a great program that's offered within Oakland County.
Okay, perfect. And for our viewers as well, Air Staff Nursing Services is a part of that agency. So if you have any inquiries in the Troy or Southeast southeastern Oakland County area. I mean, we are always happy to help, and thank you, ladies. Kelly, Kim, thank you so much today for your time and for everything that you do for Oakland County. We really appreciate it. As a resident of Oakland County, I thank you so much.
Yes, thank you for having us.
Yes, Maggie, thank you so much for having Kelly and I. We were really looking forward to this interview and talking to the citizens of Oakland County. So thank you.
Absolutely. It's been our pleasure today. That concludes our show at Boomer Health at Home. Again, I'm your host, Maggie Jess. Stay safe and healthy.
Hi, my name is Greg Jamian, and you've been watching Boomer Health at Home, powered by over 40 years of home health care experience and knowledge, along with our program sponsor, AmeriCare Medical. And please, don't forget to like us if you enjoyed our show.